Hey everybody, this is Dr. Dustin Hendrix with Chiro Specialist. We're going live right now. We are going to be getting into chronic pain treatment part 2. Before we get into that, I wanted to talk about some stuff that some people were talking about. We had some comments, about, acute pain and kind of how to approach that and stuff. So we wanted to kind of backtrack and talk about that. And then the other thing that we wanted to talk about is we wanted to kind of shore up what's going on with pain neuroscience education and exactly how that works to calm down pain. Because the reality is, we'll get into that. It's just a lot to unpack, and we want to make sure that we don't go too deep too soon. So on this one, you'll notice that under our courses, we can actually go back to our main menu. So let's go right here. This is our chronic pain recovery class. So we felt like we were kind of leaving the people who were recently injured and afraid of movement in the dark here a little bit. So we wanted to kind of go back and address that. So I wrote a blog this week on what's going on with acute injury and why we should be moving. This will go back to our website, and it's just what's replaced RISE. And it's actually moved to what we call peace and love. There it was. It didn't show up at first. And it's really interesting. You'll notice that this is exactly what we've been doing in our office pretty much since day one. And basically we're approaching it from a different perspective of loading the tissue appropriately and safely, educating people, exercising safely, getting blood flow there. The things that we had that people were a little confused on was, well, the avoiding anti-inflammatories and not icing. That's been something that's been taught to us since 1978 by Dr. Markinen, and we kind of get into that and how in his blog he talks about that he wrote in 2015 that he was wrong because rest, ice, compress, elevate, the rest and the icing is actually delaying the healing process. And what's happening there is you're not getting the blood flow there. And the common example that I've given people is low-grade fever, you let it run because it's your body fighting a natural infection. So it's the same thing when you have a little bit of swelling and inflammation. It's not always the best idea just to kick it out. We actually want it to be there so it can heal. And they go really deep into this one. And if you actually look at it was the British Sports Medicine Journal, BSMJ, I believe. They kind of gave me an idea for the skeleton of this one. They go into it like the neovascularization and like all the big fancy science words and stuff, but the blog kind of breaks it down and makes it easy. So we wanted to give you that resource if you are afraid to move and you've recently had pain, so you have an outline for it. If this outline is still hard to apply, we're always here in our office. We would love to help you see how we work through pain with people who have recently been injured. So we don't want to go too much onto a tangent on that one. We want to kind of stay on what's going on, but I wanted to give you guys that awesome resource. So you'll notice that we've now built out this one, and bear with me as we build these things out. There will be return to module 1, module 2, things of that nature. I'm also acting as the design website developer as well, so got a few irons in the fire, but keep up there with me. Okay, so let's move into this one. So main thing, teaching people about pain, learning about the pain, and learning that it's safe to move again. And from that's how we conquer chronic pain. We did want to kind of backtrack a little bit more, and we wanted to kind of open up that one a little bit more because we feel like we've just been kind of dangling the carrot there, leaving you hanging a little bit. So let's look at what we're exactly talking about and how that works. I wasn't entirely sure that we could post this picture on our website, so I didn't want to overstep on anybody, but we've attached a link, and I have instructions on how to approach this link. Institute of Chronic Pain, so we really appreciate this. So we'll actually be getting into this metaphor and analogy next week. So what we'll do is we have the instructions on this. So basically what they had somebody that had been in pain for over 2 years, and you'll notice the brain scans here, if you can follow from my mouse, what's happening with that person's brain. And then all of a sudden they introduce that thought of that painful movement, or even introduce the painful movement. I have to double check what they did there, but they introduced the painful movement to them, and then you see the red blobs on the brain. And then you can see now after we start teaching people the pain neuroscience education, and then we started to have changes in the brain. So it's quite amazing. So basically what's happening is you're calming down the nervous system. And from that calming down of the nervous system, it starts to rewire, and that's what they call neuroplasticity. And we don't want to get into those big words, but it just means changes in the nervous system. And you notice these immediate changes pretty fast on the functional MRIs. And then to make it lasting and longer, that's where we go and we do the movement. This is why we've offered this free course, because some people have been in pain. We saw one the other day that was in pain for 30 years, and we introduced them to this course and these findings, and we're using this in what we call a review of findings, or how we explain to people what's going on. So it's so big. I wanted to make sure we backtracked a little bit and really explain why we're really hammering this so hard. But we'll start now unpeeling those layers of things that's going on. So we're going to go back here to our course. So we've talked about all that. So it's very interesting. So we posted a Facebook post about a quiz. Okay. With this quiz, we wanted to introduce misconceptions of pain neuroscience, and this was from Mosley. So we really appreciate him. Once again, we stand on the shoulder of giants. It's just a really exciting time to be a chiropractor and the changes that are going on with this biopsychosocial and figuring it out. But if you want to, this will be a great place. If you haven't seen this one or you didn't see the post, stop the video before I go on and talk about it. If you're following live, sorry about that. You'll kind of just have to kind of mosey along with me through it, but you can go through it afterwards. So this will be on our YouTube as well. So what I want to do is I don't want to go through the whole quiz, because the true answers, you basically already have the answers for that one in the science that's going on, but we want to address the false answers. So it's really interesting. So one of the false answers was, when part of your body is injured, special pain receptors convey the pain message to your brain. So this was what we were talking about last week with the Cartesian system. You hurt something and it sends signal to pain to the brain. Well, it doesn't actually work that way. And it's really fascinating, because when I was studying this was like a sacred cow, something that we really held on to, that we had to address, because in school, we were taught, the C delta fibers versus I think the A beta. So we were taught like, okay, this is where your immediate pain fibers will go in during sharp pain, and this is where your fibers come in for like chronic pain. But it's really interesting because it's not that nice and neat. So what's really happening is we have afferent receptors, and it's just a fancy word for what your body's feeling. So right now, my body is feeling the couch, it's feeling the cushion, it's feeling the fan blowing on me. So what's going on is you're feeling tension, pressure, vibration, so mechanical, chemical, but none of that's pain. So when we actually get pain is when the brain decides that a signal that's come in has become pain. And this is where it's going to get really, really important, because this is where you can look at it and say, okay, so we don't have a direct pain receptor. That makes sense why he keeps hammering the tissue is not always the issue. Because the tissue isn't what determines if there's pain. It's the brain that determines it. It's when the brain says, hey, this is a danger signal, that something becomes pain. So this is a really important one. This quiz is where we're really starting to get into the meat and the potatoes of what we're trying to do here, because this is where we really start to rewire how people think. Pain only occurs when you're injured. So this is kind of funny. Have you ever stepped on a Lego? Yeah, it hurts really bad, right? But I mean, obviously you wouldn't go to the ER and be like, I stepped on a Lego, I'm gonna die. You know what I mean? But that hurt really bad. So, you can get pain when you're not injured. Athletes know this all the time. We hurt ourselves a little bit on the field, but we're not going to pull ourselves out. So we stay in the game. And, a lot of times, tweaks, little injuries, stuff like that, we're very familiar with working through that stuff. So we're going to go to another one. The timing and intensity of pain matches the timing and number of signals in the nociceptors, the danger signals. It ultimately comes down to the brain again, y'all. It depends if it perceives it as a threat. And I want to add an extra wrinkle here. Your nervous system, I kind of call it, it can be extra sticky or extra sensitive at some points. So let's say you have a lot of stress going on at work. Let's say you, stress at work. Let's say you've had a previous injury to an area. Let's say you have another spot that's injured. Diet, you're not taking care of it, or you have food allergies, things of that nature. The best example I have of this one is we had a patient who was responding decently to treatment. What I mean by decently is they would get better post treatment, and it would last for about 2 days to a week, but then the pain would come back. And we treated around 4 to 6 visits, which is our typical average time to see an acute type tissue issue respond. But the patient didn't get better to the level that I wanted them to for the functional independence. So we went back, we asked more questions into the history, and we found out that there was a vitamin D deficiency that had been missed. And the amazing thing is we got her to go back to the primary care because on this one, it was a prescription-based vitamin D. We won't get too much into nutrition here, but basically her body couldn't digest vitamin D supplementation, so she needed a prescription base. So we had her go back to her primary care. They put her back on her vitamin D supplementation. Pain was gone in 2 visits. We didn't see her again for 3 months, living her life, going to soccer games with her kids. So it's really amazing. So when we look at why the brain picks up on damage, it's a very, very complex web. It's not just simple. And this will make a lot of sense for people because a lot of times we've seen people in office try to pick up a shoe and then it causes back pain. So that was a very tough question to answer as a young practitioner of, yeah, well, it doesn't make sense. Like, how did somebody pick up a shoe and hurt their back? Like, that's not traumatic. So, it's really interesting to think about that, but I don't want to get too bogged down here. Nerves have to connect a body part in order for that body part to be in pain. That's not true. So this is really fascinating. This is called phantom limb syndrome. So we had people who had amputations. So, your knee had been cut off, your leg had been cut off knee down. People were having pain in the area that had been cut off from the body. And it was like, wait, what? And this is where the brain comes in. And, I don't want to get too much into the weeds, but it's very interesting. This is where the mirror therapy comes in. So you can actually put a mirror on people and you can have them move what would have been the original body part. And from the brain actually seeing the movement in the mirror, the pain will stop. It's because of the rewiring and the functional MRIs and the neuroplasticity we were talking about at the beginning on that link. So yeah, it's incredible. The body tells the brain when it is in pain. Once again, it's the brain that decides. We've kind of hit that a lot. Chronic pain means that an injury has not healed properly. So now this is where we're really going to get in there. And, I understand, this is tough for some people. They've been to, I saw the numbers, it's like people with chronic pain have been over 5 providers. So hearing that they may not have a tissue issue when they're searching for that as their answer, this is hard. I'm sorry. I don't want to ruffle feathers too much on that one. If you need a second, wait for the YouTube video to come out, pause it, process it. You may not be ready to hear this right now. We're with you. We understand. This is what we got to address to get you past this and get you moving on to doing what you love in your life. And I just gave the bruise story that we talked about last week. Worse injuries always result in worse pain. The most interesting story about this one, the basic one that we use is, let's say you twist your ankle really bad, but you're in a street and a bus is coming. Obviously, you're not going to stop about your ankle. You're going to get across the street, but then the pain will kick in afterwards. And then the other thing to look at too is, we've seen people that were, I don't want to say mortally wounded, but severely wounded in battle. And they were still able to carry on their duties, do heroic things, even though they were severely damaged. They didn't feel any pain at that point. And then you can have somebody that they go on a run, their nervous system is super sensitive, and all of a sudden they get pain and they kind of get stuck in a cycle. So it's really, really amazing how the brain gets into that. And we'll talk about that in the future. That will go into, brain meetings and what all happens inside the brain and stuff, but we don't want to get bogged down yet. We just kind of want to address this stuff. And then the other one, it's possible to have pain and not know about it. It's interesting to note that you can have tissue damage and not have pain, but you can't have the reverse. And this is where we come back, to the bruise story. So we're going to slowly unpack this. Next week, we're going to be getting into our first metaphor, where we start to address really what's going on with the sensitive nervous system and what that means and why it happens. And this will go into somebody that can even put a sheet on their foot and it just feels like a searing pain. So we're going to break down that as well. And if you're being challenged, I want you to remember, we're addressing this stuff because we want to help you and we have to get you back to movement. And this is just so important because inside our office, we can only do so much. I tell people all the time, I can get somebody in chronic pain back to functional capacity, but that doesn't guarantee that the pain's going to be gone. So at that point, it takes a little bit of effort and belief in the other person. And it's not a blind belief that I'm asking you for. We've seen the functional MRIs, we've seen this. Just what we don't have is we don't have these long-term follow-up studies of showing patient goes into office where they do movement and pain neuroscience classes, okay, and they got them functional again. The patient sees that, and now the patient continues on their life for years to come. How much will the pain drop? You know, we can't give 100% guarantee that it's going to go down to a zero, but we know we can return the functional capacity. And our best hunch right now is if the functional capacity is returned and people stay on this movement pattern on their own, then the pain will also go down. And that's what we see in our office. It's just we have complex cases. You gotta understand, I have a person in pain over 30 years just this week. So that's why we're doing this. And right now, you know, we just want to tell you, like, imagine how great it would feel. You know, hold your daughter again without pain. Being able to go on a walk again. So movement is a spark that the nervous system needs to get you going to your path of recovery. So this is really important because if you've already found something that you can do for 2 minutes, this is the light bulb. This is the aha moment. This is what we do with our patients in our office. We take people, we screen them, we see how scared they are of movements and doing certain activities. We find a way to put them in a safe environment to replicate what we call graded, or, you know, an introductory like regression to the movement, and then we build them back up to the movement. But this is where the spark comes. You may have already experienced this, and if you have, you know, this is huge. Like, if you're able to move for 2 minutes without pain right now, this is massive. This is your breakthrough. This is what you've been looking for. And remember, I know you're like, it's 2 minutes, and it's really tough when you've been in chronic pain to be optimistic at this point. But this is where it comes, you know, outside of our office, putting in the work, knowing that your functional capacity is going to come back, and then how far can we get the pain to go down? So the homework this time will be to find an activity that you can do for 3 minutes. So we're going to progress that. Now, the thing that I also want to introduce you to is, could we do 3 minutes of activity 3 times a week, maybe 4? So, you know, I still want to give you at least 1 day off in between activity, so you have time to use your pain activity guide to assess it and see, like, are we pushing too hard? And, you know, I'm a runner, so this makes sense to me because, okay, I can run 4 days a week pretty good. What if I added a 5th day, you know, and I took out 3 of my recovery days? You know, it can really make a big difference. So, you know, improvements look very different. So moving 3 minutes, that may just be enough for you right now, doing it once. Moving 3 minutes 3 times a week or 4 times a week, that may be where you're at as well. I want to thank y'all for coming on this journey. We're here for you. Take baby steps. Enjoy and relish these little steps that we're having going on, and don't forget to acknowledge the functional independence that's going on in your life. Next week, we're going to be introducing the first pain metaphor with what's going on with the sensitive nervous system, and we're just going to unpack that even more. I'm really excited about this. We've already been using it in our office to help our patients understand what's going on and to go deeper. It was really challenging trying to get into this and just not having this resource on hand, because patients need these modules broken down over time, and it's just too much to address in one sitting. Guys, thank you all so much for coming on this journey with us. We're really excited about Module 4 coming out next week. And, you know, comment, tell us how you're moving. Let us know what's working for you. If you're stuck and you can't find a movement pattern, just let us know. And Ralph is saying bye right now too, guys. All right, guys. Y'all take care. Bye.